I've been looking after my nan for the last 6 years, and the last 3.5 years she's been diagnosed with dementia. I wasn't in a good place. I was literally on the verge of crying at every single encounter with anybody, and I'd started to resent going over to look after my nan.
Social prescribing is identifying patients who have a non-medical need and matching them to the community who have a non-medical support to be able to help with this demand. Health and well-being of patients has many factors which affect it, and these social factors, if we don't identify them or rectify them early on, they will get worse and worse and they manifest as physical symptoms. What social prescribing allows is identifying this root cause problem and getting a social prescriber to really tackle or identify this problem and help come up with a sensible solution, or a solution which is sustainable for that individual.
The first time I went to see the GP, as soon as I got into his room, I just bawled my eyes out and said I couldn't cope. And he just said, "Well, do you want to take medication?" And I said, "No." He said, "Okay, let's go for having some time off of work." And then he made an appointment for me to go and see Adriana.
When I saw Kelly, she said that she hadn't been working. I then said, okay, let me refer you to a new therapy service that's available in Merton.
For all my life, I find it hard to talk to people and trust people. So obviously talking to a professional, obviously let out a few things, and yeah, it was weights off my shoulders.
I also signposted her to the social services to help get her nan a needs assessment, as she had said her nan hadn't been reviewed for quite some time.
Where you're overloaded with things and you don't know how to deal with them, it's an outside perspective but also friendly.
A part of what my role is to meet up with local community services, voluntary organisations, to build a better joint working relationship so that we all feel comfortable with referring into them and signposting to these services.
Kelly came along to my dementia cafe, the Clover Cafe. When I first met her, she was so full of energy and positivity and laughing, and a very happy person to meet. But as soon as she started talking about the kind of things that she was going through, I realised how much courage and effort it was taking to put on that cheerful front.
It's fantastic. We go there, she has a bit of lunch, she talks to other dementia sufferers. They also do a carer section where your carers can go off and just have a general conversation and help you talk about what's going on with the people that you're looking after, but also to give ideas.
For a lot of carers, they get offered a peer support group, but they literally cannot leave the person they're caring for alone at home.
Yeah, it's amazing.
With Kelly, it was just the one session, and we was able to get out all that we needed to, and it was quite even straightforward as well. I didn't even expect to call her the next time for a follow-up and for her to say, yeah, everything's great, I'm done, I don't need to see you again. You know, I didn't expect that at all.
My relationship with my nan is absolutely fantastic now. I enjoy going over to see her, I enjoy being with her.
The results from the East Merton pilot were fantastic. So we had a reduction in GP appointments by 33%, and so that meant that we were seeing reduced number of patients who were previously had social issues, and we were medicalising. So that was great for us to get. For me, it makes sense, and so it'd be great if we could really get that across the whole of Merton.
I feel a different woman. I really do, and a lot of people have said to me that have known my situation and what I'm doing, that the relief that's gone off my face, it's just phenomenal. When I was feeling low, again, I didn't let my husband know. Now, I actually do tell him a lot more. So, yeah, it's helped me to trust as well, and letting him know what's going on, that I'm vulnerable, which is very hard to let people know. But with the help that I've had from Adriana and the online therapy, I'm learning to let people in.